It's a wonderful thing to celebrate 3/4 of a century of WHO improving health. I became interested as a teenager 70 years ago and actually wrote WHO, and I've been following their career ever since. And one of the big things in that history is smallpox eradication. Believe it or not, WHO did not want to get into smallpox eradication, and for good reasons. The yellow fever eradication program had not worked. The malaria eradication program had not worked. They did not want to do a third one. But they finally agreed and then developed just a superb program where they looked at every part of smallpox eradication and improved it. They came up with standards for vaccine and would not accept any vaccine that did not meet those standards. They improved the delivery of vaccine, and in West Africa, that meant using jet injectors, giving over 100 million vaccinations with jet injectors. And then came bifurcated needles, just an absolute miracle. Small, light, easily sterilized. You could train someone in 10 minutes to become a proficient vaccinator. And so this was a great step forward. Then they looked at the strategy. In West Africa, it was shown that you didn't have to do mass vaccination. You could go directly to the virus and vaccinate around it. So surveillance containment became the way to approach this throughout the world. And country by country, smallpox disappeared. First, the 20 countries of West and Central Africa, then Brazil, then Indonesia. So 6 years into the program, there are 2 remaining foci, a very serious one in Southeast Asia and one in East Africa. In Southeast Asia, the amount of transmission was tremendous. In May of 1974, in a single state in India, Bihar, they were reporting 1,500 new cases a day. 12 months later, India was totally free of smallpox. The last case of variola major was reported from Bangladesh in late 1975. 2 years later, the last case of variola minor was reported from Somalia. The last person was a hospital employee. No one got smallpox from him. And think of this, that broke the chain of transmission that went directly back to the very first case thousands and thousands of years ago. Some people have put together the lessons of smallpox eradication, and these are now available free, a curriculum to help in other public health programs at 9lessons.org. What's the bottom line? Public health is based on a philosophy of social justice. This is the first time we've achieved total social justice. It does not matter what your status is in life or your geography, you will never be exposed to smallpox. This was a gift to the future, and WHO showed that they could be a great ancestor. Thank you.